It's 8:21. Welcome back to Fox 59 this morning. It is the last day of March and we're closing out National Sleep Month talking about sleep apnea. Millions of Americans have it and may not even know they have it. So that's why we brought back Dr. Akudo Anokwute. She joins us in studio this morning to talk about the signs you might have sleep apnea. It's good to have you back this morning. Appreciate it. You were here a couple of weeks ago.
Yes.
So let's talk about what is the most common type of sleep apnea and how does it affect someone?
Yes, so there are two main types. The most common type is what we call obstructive sleep apnea, and that is when the muscles of the upper of the throat closes up and people stop breathing while sleeping. And so because of that, they're not getting enough oxygen while they're sleeping. And so long term, that could lead to many complications.
Yeah. Let's talk about the signs and the biggest signs that you might have it.
Yes. So the big one is snoring, right? And
who doesn't do that?
I know. So I get lots of patients and the men come in, they say, oh my goodness, I can't sleep in the same room with my wife because of the snoring. And that's not the only symptom, you know. People wake up multiple times a night. They're not sure, why am I waking up? Stop breathing. And, you know, I've had patients bring in recordings of their spouse where they stop breathing. Yes. And, you know, in children, it could present differently, and these are the age group that we often overlook. You know, they're sleeping in awkward positions with their neck extended, they're mouth breathing, they're restless, they have ADHD-like symptoms. You know, these are very common things. In adults, they could wake up with headaches in the mornings and, you know, feeling really sleepy and tired during the day.
So if someone is dealing with this type of situation, how do they know? How are they formally diagnosed?
Yes. So there are two main ways. Now it's really easy. Before it used to be you have to go to the hospital, get into the sleep lab and get diagnosed. But now we have really cool home sleep studies. And so you can start out that way. You take a home sleep study home. Some of them are like wristwatches, really nice and easy. And a good place to start would be with a home sleep study.
So is it like a sleep test in a way?
Yes, it is. Yes. So it tells us about your oxygen levels, how low it's dropping, and it helps us make that diagnosis. Is it mild, moderate, or severe sleep apnea? And some people may eventually still need to go into the sleep lab, but definitely starting out with the home sleep study is a good option.
We have to talk about the benefits of having this done. Because on the other side of this, you sleep better.
Yes, absolutely. So the benefits could, you know, go short term and long term, right? In the short term, you feel much better. You feel refreshed when you wake up in the morning. You feel like, oh my goodness, I can power through the entire day. Yes, I'm so energetic. I don't feel sleepy at 2 p.m., you know. And then long term, there are complications that we could prevent. We're talking about a stroke. We're talking about heart attacks, heart failures, hypertension, diabetes. These are complications that we will be preventing if we diagnose and treat.
And this is something that I wanted to ask. This affects all age groups.
Absolutely.
It's not a particular age range.
Absolutely.
Anyone who sleeps could be affected by this.
This is correct.
All right, Dr. Akudo Anokwute helping us out to get some good sleep and don't have sleep apnea as we close out National Sleep Month. We appreciate you being here. Hopefully,
thank you so much.
Jim, I can get good sleep today because last night I was dealing with the ceiling fan issue going in the wrong direction.